Healthier Together, sponsored by Regents Blue Cross Blue Shield of Oregon.
You can also unplug from television, from social media. Don't inundate ourselves with these negative ads that we're all seeing over and over again. I think that becomes very stressful. So take a break from that.
From elections to the holidays, November is ripe for stress. In today's Healthier Together, we're navigating some of those triggers to help you cope and manage your mental health. First, we just had a time change, falling back an hour. And with the rainy season already here, seasonal affective disorder can impact many of us. In fact, 9% of people in the Northwest have it. Here's Senior Medical Director for Regents, Dr. Mike Franz.
Fatigue is really a predominant symptom, as is low mood and decreased interest in activities you've previously felt were pleasurable, but also an increase in carbohydrate cravings, an increase in appetite is specific to seasonal affective disorder.
If this sounds like something that you're going through, Dr. Franz says talk to your doctor.
Because this is treatable. In addition to perhaps psychotherapy, or in some cases medication, the most effective treatment for seasonal affective disorder is actually bright light therapy. And you can get a light. It needs to be of a light intensity on a scale of lux, and it's 10,000 lux.
Elections can, of course, be a big trigger, too, worrying about the results and democracy and all the negative messaging.
The American Psychological Association did a study which recently showed that 70% of people don't even think that their country and their government cares about them anymore. Another study says that 40% of people have thought about leaving the state in which they live because of the politics. And then on top of this is just the concern about the economy and inflation.
Try to unplug from social media and take a break from constant news coverage. Focus on the things that you can control. And finally, one of the biggest stressors, the holidays. The most wonderful time of the year isn't so wonderful for everyone for a lot of reasons: grief, family conflict, and unrealistic expectations.
Folks do associate the holidays with loss. They remember how things used to be when their family member was present, and to go through it without them can be very, very challenging. Also, some families just have a lot of strife, and when you are in the holiday period, there's expectations to spend more time with your families. And for some folks, this is just inherently stressful.
Dr. Franz says acknowledge those feelings and try to manage expectations.
Holidays are seldom perfect for everyone, so cut yourself some slack. If it doesn't go that well, that's okay. And plan ahead. If you can, take care of some things, whether it's the shopping or the cooking or scheduling the travel, do it a little bit in advance so it all doesn't pile up on you at the last minute.
And keep up with your healthy routines. Indulge in the season, of course, but try to keep on track.
Do some self-care, refuel. Make sure this is a time when you're getting plenty of rest, you're trying to eat as healthy as you can. Stay physically active, of course, that's always important.
No matter what's causing stress in your life, Dr. Franz says to talk about it, and there's help to manage that stress if you need it. 988 is the National Mental Health Hotline, connecting you to local resources. For more on managing stress and mental health, visit kgw.com/healthiertogether and tune in each week for more news that you can use to better your health.